Hello, my name is Dr. Ken Dietrich. I'm the Chief Medical Officer at Summit Pacific Medical Center, and I'm taking a bit of time to share some information with you about the COVID virus. We've been receiving many phone calls from our community members and lots of questions, so I thought I would answer some of the frequently asked questions for you. And I want to encourage you to continue to call us in with questions, and as we get new and different types of questions, we'll try to repeat this so that we can provide you with the most up-to-date information. Just to begin, I want you to know that Summit is very committed to providing care for our community, whether a patient has COVID-19 or any other respiratory infection, and we're working very carefully with our county health department, state health department, and following very carefully the CDC guidelines to manage this disease. Secondly, I just want you to know that we believe, and the CDC believes, that this is an infection that is everywhere. So we should assume that it exists in Grace Harbor County and take appropriate precautions. So what are some frequently asked questions? One of them is, what are the symptoms of COVID-19? And COVID-19 is a respiratory virus similar basically to all other respiratory viruses and quite similar to the flu. So the typical symptoms that someone will have is beginning with light fever, sore throat, runny nose, and then as the disease progresses down the respiratory tract, you might experience cough or congestion and potentially a higher fever or even shortness of breath. These are very common symptoms for a very large number of viruses that we get this type of year, so there isn't anything that's distinctive about COVID-19 that will let you know, oh, I have COVID-19 or I do not. It does not seem to be causing a lot of sneezing, so if you have allergies and you have this time of year start having that, this does not mean that you have COVID-19. Another common question is, what should I do if I feel sick? And this is one that I'm sure you've thought about or someone has talked to you about. First and foremost, we're trying to limit the spread of this infection, and the way to do that is to limit contact with people who have the infection. So the first thing that you ought to do if you're getting sick is to stay home. You should stay home from work if you're having respiratory symptoms and fever. It's a good idea if you have those symptoms to wear a mask even when you're at home to limit the spread to your family members. Secondly is just kind of pay attention to your symptoms. If it's a common type of cold symptoms where you kind of feel bad, you have a cough, maybe a little bit of fever, but you're eating and drinking and able to get around and rest, there's nothing else to do but just to be patient and wait. Most patients who experience a respiratory infection, and in particular COVID-19, will have minimal to mild symptoms. Probably 90% or greater will never even need to see a healthcare provider or need to be hospitalized. So first and foremost, stay home, take some Tylenol, drink plenty of fluids, and just keep track of yourself. Then when would you need to seek medical attention? If you start having very high fevers, you have shortness of breath where you're really having difficulty breathing, then that would be the time to seek medical attention. And there are several options for doing that. The first one is on our website, you can look up COVID-19, there's information there, and there's a phone number that you can call and speak to a nurse. That's a good way to screen whether or not you really do need to come into the hospital or don't. Secondly, you can do a televisit. So on our website is a link to a televisit where you could talk to a provider, do it electronically from your home, and in real time determine whether or not you need to seek medical attention. After those two options, you could come to Summit, and we have a screening process for patients to screen patients whether or not they need to be seen, and then into our emergency department or our respiratory care unit where you would be seen. Lastly, you could also call your primary care provider, but we strongly encourage you to make a phone call to talk to them and let them know your symptoms before proceeding to your primary care provider's office. Again, the reason for that is to try to limit your exposure. And then lastly, if you're going to leave your home for medical care, please make sure to wear a mask to try to prevent the exposure to anyone else. Another question, should I be tested for COVID-19? This is a very, very common question, and one that you would probably like to know the answer to in terms of, do you have the infection? Unfortunately, there are a number of restrictions that are making it difficult to test patients. First and foremost, need to know that this is a viral infection and there's no specific treatment for it. So getting the test result is not going to change your severity of illness, how long you're going to have the illness, whether you recover, and it doesn't change how we treat it. because there's no specific treatment for this disease. So the test is informational only. Secondly, the test can take up to 4 days to get the results, and by then most patients are getting better. The primary reason for testing is so that the public health department can know if someone's positive, do they have other people at risk, and then should we do quarantine or containment. So right now we're recommending at Summit that we only test patients who are sick enough to be hospitalized, and if they test positive, then secondarily look for those close contacts. We're also testing healthcare workers, EMTs, EMS, firefighters who are first responders who have been in contact with someone or potentially in contact with someone with COVID-19 and are having respiratory symptoms as well. Another component of testing is, even though there are maybe growing labs that will do the tests, we have very restricted supplies for obtaining the test. And currently our resources are very limited. Across the country, there's back orders on the testing kits for doing this test, and until those come available, we have to be very selective for those patients who are very ill to test. So right now, we're not recommending testing of the general public or people who have mild disease. What should I do to reduce the risk of getting COVID-19? That's a very important question. First and foremost, the best way to reduce your risk is to reduce your exposure to people who might have it. And so reducing travel outside of home, to necessities, not going to venues that have a large number of people that are coming together to meet will help. If you're over 60, you have other comorbidities, lung disease, diabetes, heart disease, it's a good idea to kind of self-quarantine yourself and minimize the amount of time that you're out of your home and exposed. Another good idea is to limit those who come visit you. So if someone has a fever and a cough and cold, it's a good idea to say, hey, stay home, take care of yourself, call me, FaceTime, but limit the contact. Again, to remind you, the ways that we believe this is transmitted is by droplets. So someone sneezing who has the infection within 6 feet, it gets on the counter, gets on your hands, and you put your hands to your face. So the person who's infected wearing a mask, or if you're exposed, wearing a mask and washing your hands, making sure before you touch your face is the best way to prevent it. And lastly, if I develop a respiratory infection, when can I go back to school or work? Currently, the recommendations are to stay home from work or school if you start to have respiratory symptoms and a fever, and then to stay there until your fever is absent for 3 days and or your respiratory symptoms are resolved for 3 days. So this is a little longer than we typically would recommend after a typical cold or virus, but again, because we're trying to limit the exposure of people who may have the infection to the general public, we're recommending now 3 days past the fever or infection. I hope this has been helpful, and perhaps we'll talk again.